Dr. Mandell here with you. A great video. I want to explain how we can increase mobility and better function in the upper neck and lower skull, the suboccipital or occipital region. The atlanto-occipital joint, as you see here, is the occipital area that sits on top of the atlas. Look here. Here is the back of the occipital bone that sits on the atlas, the first vertebrae. And this joint glides like this. It just glides over the joint of the atlas like this. So what we're going to do is that we're going to make sure that the gliding motion in our neck is working correctly. And by this technique, by increasing the mobility and freeing up adhesions, which is a sticky scar tissue that's limiting mobility, and or a fixation or misalignment in the joint that's potentially causing decreased mobility, decreased function, by increasing mobility in that joint, freeing up the fixation and getting movement and joint play back into the joint again, can take away a multitude of symptoms, from headaches to neck pain, the pain over the head behind the eyes, a multitude of symptoms of like tinnitus or ringing in the ears, decreased mobility. The bottom line is you have a tremendous amount of nerves that come under the skull, that go over the head behind the eyes, that can affect the eyes, affect the equilibrium. The bottom line is, let's get mobility in this in a very safe, effective way to get you feeling well again. So doing this technique, it's very important that we get this gliding motion. We're going to lie down, but I want to show you sitting up to give you the understanding that this is the motion we want. Watch here. It's not this way, it's not this way, it's just gliding, just like this, back and forth, okay? Because by gliding, we're freeing up all this mobility, because a lot of rotation and movement stems from underneath the back of the occipital area. So if you watch me, this is the way it should look. We're gonna grasp the top of our back of our head right about here, not back here, but up on top. And as we push down and forward, this is the movement that it's gonna look like. Okay, you'll feel the back of the joints just glide, that back of the occiput glide on the atlas. But we're gonna do it lying down, therefore we can get these muscles to relax. Okay, so what we're gonna do, we're going to contact the upper part of our head in the back area like I was sitting up, and relax the neck muscles, and you're gonna push down and forward. Do not use the neck muscles at all. This is what it should look like. Okay, you'll feel the top of the occiput glide over the first bone of the atlas, and you'll do that about 15-20 times. And then you'll turn to the right and do the same thing. And you'll feel more on the opposite side, the joint, making sure we're freeing it up about 15 times. Okay, and then you'll come to the opposite side and you'll do the same thing. You'll feel the opposite side of the joint opening up to make sure that we're putting motion in all three areas. Okay, about 15 times or so. So do this technique as often as you like. You're just increasing mobility in that joint. By increasing mobility, you're increasing function, and you're going to help restore proper movement as well as proper nerve supply. Hopefully that will take away a lot of those bad symptoms that you've been complaining about. Share this video, check me out, Motivational Doc on Facebook, leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.